So the title of the talk is Protecting the Skin You Are In, and I'm Germscheid. I'm a general surgeon at Grand Itasca. So brief kind of overview of what we're going to be discussing today. Because I'm a surgeon, you're going to have to suffer through a little bit of anatomy. We're going to go through some skin facts, just some basic kind of interesting things about your skin, and sun facts. Then we'll kind of marry the two and talk about how UV rays affect the skin. Then we're going to move on to how we can try to protect ourselves from those UV rays. And to kind of finish up, we're going to do some simple sort of identification of skin lesions, some sort of good examples of benign versus malignant lesions, things you need to look out for, how to check for them, and what we do to treat them. So I like to think of the skin as essentially two layers. There's the epidermis, which is the upper part here, the lighter part, and then the lower part, which is the dermis. And the dermis is, as you can see, has kind of your sweat glands. It's where the hairs start, some blood vessels, a lot of nerves. And the epidermis is kind of where, with regards to protecting your skin and skin cancer, kind of where the action is. That's where most of the skin cells that we think of skin cells are. That's where they turn over, reproduce, and a lot of the scarring and skin cancers come from that thin layer on top called the epidermis. So the skin counts for about 15% of your total body weight, so it's a big organ. And the average person has about 300 million skin cells over your entire body. The skin itself turns itself over about every month. All that whole layer turns itself over. And that's, you've heard about your house getting covered in dust and skin cells. It's easy to imagine when you know your whole skin turns over every month, right? And the skin is thickest on your back and thinnest on your eyelids. The reason it's thickest on your back is, the thought is that it's an evolutionary thing. When we were getting attacked from behind by saber-toothed tigers, it was of benefit to have thick skin on your back. And why it's thin on your eyelids, I don't know. And the skin itself contains all sorts of natural defenses. Like the saber-toothed tiger thing, it's a strong physical barrier. It also provides insulation. Most of our insulation is below the skin, but the skin does insulate. The skin itself will absorb and deflect that harmful radiation. It's the pigmented cells within your skin that will absorb a lot of that UV radiation. It responds to insults and injuries. It changes color. We tan to try to protect ourselves from ultraviolet radiation. So when your skin starts to get really tan, it's sort of something you should take as a warning sign to say, whoa, I'm spending a lot of time in the sun. And this is a kind of a cumulative effect, the way the UV radiation kind of essentially builds up in your skin. And I'll kind of explain a little bit of how that happens, but it's a little bit convoluted and a little bit outside of the scope of this talk. The skin thickens in response to injury. Think of your hands and feet, thick calluses, and it's able to heal itself. If you get a cut, it heals, you scar. And so moving on to a few things about the sun. It's a gigantic, huge source of energy, probably something that is underutilized. It grows all our crops, provides warmth, we can turn it into electricity. It's great, we need it, right? It heats the planet, provides light during the daytime. And it takes light from the sun about 8 minutes to travel to the Earth. And so when you're looking up at the sun, you're actually looking 8 minutes into the past from the sun, which is kind of interesting thought, even though I don't know if there's much to see on the sun. And it emits the full spectrum of visible light from infrared all the way to ultraviolet. And the composition of sunlight, the sunlight actually changes throughout the day as it kind of pitches and gets refracted through the atmosphere. And the ratio of UV light also changes throughout the day. Something that the National Weather Service came up with to sort of warn people about your risk for exposure of UV light during the day is the UV index. So the National Weather Service will come up with a number, and what it is, it's how strong the sun's rays will be at noon that day. And you can find that information through the EPA. Lots of sunscreen websites will report it. There's an app that the EPA has where you can just check it every day. Right away you'll have to punch in your area code or wherever you are. You can turn on your GPS on your phone or allow your phone to access that, and it'll just tell you where you are every day. If you take a trip down to Florida, you look at your app and it'll tell you what it is in Florida, and it'll give you a number 1 through essentially 11. And kind of as the color indicates, the low side of the spectrum, when a level is, the index is 1 to 2, that's low. And when it's a 1 to 2 index, you essentially need no protection from the sun. It's okay to be outside with minimal sun protection. The American Academy of Dermatology recommends at least an SPF 15 skin protectant every day, whether it's sunscreen or whether it's makeup with some sun protection factor built in. That's always something that they want everybody to have every day. Moderate to high UV index is from 3 to 7, and that's when they would recommend extra protection from the sun. They would say seek shade, especially from the peak sun hours, which are 10 a.m. to 4 p.m. They would definitely recommend sunscreen, protective clothing, all the things that we'll kind of go through in a little bit more detail later on. And when the UV index is 8 or above, certainly take extra precautions. Do your best to try to stay out of the sun, because unprotected skin can burn in as little as 10 minutes. So good to be careful. And if you can't remember all that scale and the UV index, the EPA does give a nice kind of rule of thumb, which they call the shadow rule. And the shadow rule is that if your shadow is taller than you are, which is generally in the morning or in the evening, then your UV exposure is likely to be low. But if your shadow is shorter than you are, which is around midday, those peak sun hours, which again are 10 a.m. to 4 p.m., you're being exposed to higher levels of UV, and where you should seek shade, wear sun protection, clothes that block the sun, wide-brimmed hats, and all that good stuff. So now we're going to talk about how the sun affects our skin. And when we talk about how the sun affects our skin, we're essentially talking about ultraviolet light, UVA and UVB rays. So UVA is a type of ultraviolet light with a little bit longer wavelength that allows it to penetrate deeper into the skin. You can see it makes it all the way through the dermis. These are the predominant types of rays in sunlight. About 95% of the ultraviolet light in the sun is UVA rays. And because it gets deeper, makes it through this kind of top layer, the epidermis, it's responsible for essentially the sun damage you see on your skin. The energy from this ultraviolet light makes it into the dermal cells. A lot of these are cells that make and maintain collagen. And what happens is these energy gets into your cells, it excites electrons, it creates oxygen-free radicals. These free radicals can damage the cell, damage DNA, and also upregulate proteins, meaning tell the cell to make more proteins that activate a protein, that activates a protein, that eventually activates a protein that degrades collagen and elastin, which gives your skin like a nice bounce and turgor, and over time, if enough of that gets degraded, can lead to wrinkles, thinning of your skin, and so forth. And so why would we even have molecules that break down collagen and elastin? Well, they are helpful when you have a scar. Right away when you make a scar, collagen and elastin build up, they pile up, they just want to make that scar strong. But over time, these proteins that degrade collagen will help the scar soften, reduce in appearance, reorganize that collagen, and make it more normal dermal tissue. But unfortunately, UVA light activates those proteins when you don't want them on, and will cause those effects to your skin. UVB light does not penetrate as deep, though it is higher energy. It's not nearly as abundant as the UVA light. Like I said, about 90 to 95% of UV radiation from the sun is UVA light. That again changes throughout the day, but that's generally the percentage. But the UVA light or UVB light, excuse me, is one that doesn't penetrate as deep, a little higher energy, and for that reason, this is the skin cancer causing rays, essentially. How these cause skin cancer is they'll penetrate down into the skin layer and actually directly damage the cell's DNA. It'll cause damage in the DNA, and because your skin is something that turns over relatively quickly, that, I guess, damage in the cell's DNA can get passed on to the next cell when it grows and divides. And if enough of those pieces of damaged genetic material get passed on, it can form a cell that can turn into cancer. essentially. These are also thought to be the sunburn causing rays, the UVB rays. The pathogenesis of sunburn is not very well understood. It's something that's extremely common, but apparently hard to kind of nail down the mechanism. But as far as we know, the DNA damage triggers inflammation, vasodilation, which is why your skin gets really red and inflamed. All those little tiny blood vessels in there, and you can see in the picture, all get super dilated. They bring a lot of fluid into that area, gets swollen. And if the cell gets damaged enough by the ultraviolet light, either DNA damage or damage to other parts of the cells, your body will recognize that cell as non-viable and cause it to essentially self-destruct in a controlled manner, so it's not spilling cell contents everywhere. But if you get bad enough damage and extensive enough damage, you can lose enough cells, and that is thought to be the cause of the blistering, is that you lose kind of a whole almost layer of cells, and the extra fluid that's brought to the area to, with the inflammation reaction, causes the fluid within the blister. So that's the types of ultraviolet rays that we're worried about. So when it comes to protecting your skin, this is a list that the American Academy of Dermatology has put out that we can do to help protect ourselves. So of course, use sunscreen. That's something we'll dig into a little bit deeper here. You should always seek shade, and just that physical barrier of blocking that UV light and the sunlight will help tremendously. Dress to protect yourself from the sun. Clothing has a sun protection factor, an SPF to it, and darker, thicker clothes have a higher SPF. And be cautious when you're around water, snow, and sand, as these things can all reflect ultraviolet light back at you, which people around here are pretty familiar with. If you're on the lake, the sunlight's a lot more intense than it is if you're in your backyard or in your garden or whatever. Avoid tanning beds, of course. That's just unnecessary exposure to ultraviolet light. Get vitamin D safely. We all get vitamin D from the sun. It's the sun's energy and the sun's rays that help our body convert the chemicals in our body to vitamin D, which we need. And the last one is check your birthday suit on your birthday, which is just a reminder that when that special day comes in a year, to maybe give yourself just a full check in the mirror. If anything looks suspicious, abnormal, if there's something that you've had your eye on for a little while, check if it's changing. If it is, seek a professional opinion. Your primary care doctor does a lot of dermatology. They may be better at identifying skin lesions than I am, but if there's something that they're worried about, that they think could be a cancer or a pre-cancer, then you get the referral to me. And that's when we talk about biopsy and other things. So, sunscreen. No brand is any better than another brand. What you're looking for in any sunscreen is these three things. It's got to be broad spectrum. It's got to have an SPF value of at least 30, and you want it to be labeled water resistant. So, moving on to the first part, broad spectrum means that it's able to absorb or deflect both UVA and UVB rays, which is important to use even when it's cloudy, when the UV index may be low, because both those types of ultraviolet rays can penetrate the clouds. In fact, 80% of UV light can penetrate clouds. So I'm sure you've heard it before, but even on cloudy days, you need to protect yourself from the sun. UVA rays can penetrate glass. A lot of new windows, the windows in your car, are good at deflecting ultraviolet light, but some of those UVA rays can actually still make it through glass. Hence the recommendation for using a sun protection factor essentially at all times, which, if you take care of people's skin for a living, that's an easy recommendation to make. Not something that's as easy to practice, right? And like I said before, the surroundings can reflect UV rays. For example, the sand, if you're hanging out on the beach, can reflect up to 15% of the sun's rays. Snow and water can reflect up to 80% of the sun's rays. And even just being on the ground, the grass in your yard, can reflect up to 10% of the sun's rays. So important to be careful anytime you're outside. The second thing you're looking for would be a sun protection factor of 30 or higher. And what SPF means is sun protection factor, and what the number 30 means is that it will take you 30 times as long for your skin to burn when you're outside. So If you are a fair-skinned individual who burns quickly, if it would take you 10 minutes to be out in the sun to get a sunburn, applying an SPF 30 sunscreen, it would take you 30 times as long, or 300 minutes to develop the same sunburn. So pretty powerful stuff. And SPF 30 will block 97% of the UV rays. SPF 15, for example, will block 93% of the sun's rays. SPF 50 will block about 99% of the sun's rays, but no sunscreen blocks 100% of the sun's rays. And another thing that's important to consider is higher SPF sunscreens don't last any longer. Just because you have SPF 50 on, the American Academy of Dermatology and all of the directions on your sunblock bottles would say that you should reapply at least every 2 hours. Those rules change, of course, if you're active or if you're in the water. And the last thing that you want to look for in your sunscreen is that it's water resistant. That means essentially that it's effective for up to 40 minutes in water. There are sunscreens that are very water resistant, and what that means is that they are rated to be effective for up to 80 minutes in water. And always with the caveat that you should reapply after getting out of the water. The AAD, the American Academy of Dermatology, recommends it should take about 1 ounce of sunscreen to cover your entire body. That will fill up about 1 shot glass. I know you guys know what that is. And for you teetotalers or your bakers out there, that's about 2 tablespoons of sunscreen. And that really should be enough to cover your entire body. And important things to remember are your ears, feet, hands, your head, lips, ears. You know, don't be putting sunscreen on your lips. Get a chapstick or something that has some SPF in it, because we see a lot of skin cancers in the areas that people miss. Those things exactly. And a note on spray sunscreens. While they're convenient, especially for children, for wiggly children, something that I'm dealing with right now, you just don't know how much they're getting. You know, they obviously don't need as much as an adult, but there's no way to tell really how much of the sunscreen is making it onto their skin. So it's best if you want better control of that and to know that they're getting protected as well as they can with sunscreen, to use a liquid or a cream sunscreen to hand apply it. All right, so it's mentioning worth treating a sunburn. Sometimes we're just out in the sun too much, we forget sunscreen, it's a high UV index day, and we get a sunburn. I mean, show of hands who's had a sunburn, right? Yeah. So what you need to do to treat a sunburn is to get started as soon as possible. The cool baths will feel good. Your skin gets inflamed when you get a sunburn, and so when you have inflammation anywhere else, an ice pack will help calm that down. So a cool bath will be something that will just feel good and keep your skin from getting so inflamed and painful. And what the instructions are after you get out of the bath or out of the cool shower or whatever is to air dry. And before you're completely dry, apply a moisturizing lotion to try to trap that against the skin. Because your skin's going to get hot, it's going to just evaporate more fluid. Those insensible losses are something that could cause you to be dehydrated. So it's best to try to drink plenty of water for that reason, because your warm skin is just gonna evaporate more. A hydrocortisone cream is another way that you can get at some of that inflammation. Should help the skin kind of feel better. Aloe has sort of a cooling thing that feels good, but to my knowledge, it doesn't have any specific anti-inflammatory properties. Most aloes have a moisturizer built in, and they feel good. And so for that reason, I mean, absolutely something that you can be doing. Aspirin and ibuprofen are both anti-inflammatory type drugs and should help with the pain of a sunburn. The blistering is an indication of a second-degree burn. And what that is, it's a burn through the top layer of the skin, which is like a significant burn. The important things to remember are that if you do have blistering from a sunburn, is try to leave those blisters intact as soon as possible. That skin underneath is not ready to be exposed to the outside world. So popping blisters, scraping blisters off, something you shouldn't be doing. That fluid that's underneath the blister is sterile. It won't get infected unless you introduce bacteria into it. Try to leave the blisters intact. protect the skin that's underneath, allow it to regenerate, and get to the point where it will be able to protect you like your skin should. And if the blisters cover a large area, if you start to have fevers or chills, if you start to have headaches, those could be signs of your body having systemic reaction to the burn, possible infection, or severe dehydration, and those are reasons that you should seek medical attention. So we're going to circle back a little bit to the check your birthday suit on your birthday part and get in a little bit to identification of some common but worrisome skin lesions. So this here is a seborrheic keratosis. It's something that is very common. It's benign. It doesn't portend cancer. It generally starts in the 50s. You see them in multiples like this. They kind of show up all together all at once. And they can have an extremely variable appearance, but the kind of textbook description is sort of a waxy, stuck-on appearance. It's something that you can kind of peel off. They can be pigmented, they can be not pigmented, they can look crusty, but a lot of them, most of the time, will have a waxy, kind of like stuck on a piece of, I don't know, clay to your skin or wax or something that can just peel right off. The next one is an acrocordon, and this is just a skin tag. Everybody knows them as skin tags. This is the medical or the dermatology name for them. But they're skin-colored, fleshy papules. A lot of people get them in kind of around their neck, in their armpits or their axilla, groin, things like that. But you can get them anywhere. They can be tiny, they can be huge, and sometimes they can get so big that they outgrow their blood supply, can get extremely painful, and they can even fall off. These are not a marker of skin cancer. However, they can be a marker for insulin resistance or diabetes. So people who have those things are more apt to have these. This is a solar lentigo, or a sunspot. It's essentially a permanent discoloration of the skin due to sun exposure. And this one, though not a malignant lesion or cancerous or precancerous lesion on its own, they do signify an increased UV exposure and can kind of signal to a clinician that need to be a little bit more aware that there could be a skin cancer in the area. Just again, because that's sort of a marker of significant UV exposure. But in itself, not a risk factor for cancer. An actinic keratosis sort of falls in between the benign and malignant skin lesions. We do consider it a precancerous lesion. It's a precancer to a squamous cell carcinoma, but it's not quite there yet. And what these are kind of described as a rough, scaly, usually thin, red or white plaques on the skin. They're not the soft, kind of waxy things that the seborrheic keratoses are. They're usually pretty crusty, and underneath they're red. They do have up to a 20% chance of turning into a real skin cancer, so we're somewhat aggressive with treating these. If they're identified as an actinic keratosis, they have that kind of classic appearance, the first thing we try is liquid nitrogen, just to destroy all the cells in that area. What they do is the cells freeze, they break, all the hopefully precancerous cells get killed with the liquid nitrogen, and it should heal over as a pretty normally pigmented kind of soft area on your skin. If it comes back looking something like this, you didn't get it all, or it's resistant to the liquid nitrogen therapy, and we would recommend removing it. So generally when you freeze them, it takes 3 or 4 weeks for that initial kind of scab to fall off, and underneath it should look like essentially normal skin. If it doesn't, then that's when we'd recommend removing it, because it's something that's a risk for turning into skin cancer. This is the real deal. This is a skin cancer. This is a squamous cell carcinoma. This is a neoplasm of the keratinocytes, or the skin cells that's in the top layer of your skin. And they usually present as kind of an ulcerated, red, nodular plaque that tend to ulcerate or bleed. They will have kind of a lot of textbooks say sort of a rat-bitten appearance, as though there was something like chewing on it, but they present as like non-healing lesions and something that should be a warning sign that it need to be looked at by a professional, essentially. This is the second most common type of skin cancer, and it is related to sun damage. So we find them in areas where you've had significant sun exposure. Like I said, we see a lot of these on the neck and up, hands, arms, feet. You don't see too many of these in the areas that are usually covered up with clothes, just because the big risk for these is squamous or is UV exposure. There are some special situations, patients who've had transplants or who are on long-term immune modulating therapy, or patients who've received usually longer doses of chemotherapy can show up with these things in different places. But generally speaking, the general population are most at risk for these in the kind of exposed areas. So the treatment for this is essentially you resect it with negative margins, meaning you cut the whole thing out. We send that piece of tissue to pathology, and they tell us that the edges of the specimen are free of cancer, and then you're done. This type of skin cancer can rarely metastasize to lymph nodes. So generally, if we think that it's a squamous cell carcinoma, we'll check the lymph nodes in that area to see if there's anything abnormal. But the rate of these metastasizing is extremely low. Generally, when we find one of these, you cut it out to negative margins and you're done. It's easier said than done on some sort of sensitive areas on the face. You know, you'd like to be able to cut this out and close the skin back up, but if this is on your lip or your nose or your eyelid, or if it's on a certain part of your ear, sometimes getting that closed is extremely difficult. And you don't want to take out any more tissue than you have to. So sometimes when we find these types of cancers in cosmetically sensitive areas, we'll refer to a plastic surgeon who has expertise in reconstructing these delicate areas. But 95% of these that we see, we take off in clinic, and patients do just fine. Cancer gone. This is a very classic example of a basal cell carcinoma. This is the most common type of skin cancer, and this presents as a pearly papule with these kind of small vascularities or telangiectasias within the papule. They have kind of these rolled edges and usually a central sort of punctum or a little dip in the middle. These again arise from the top layer of your skin and in the sun exposed areas. So same spots you'd expect to see a squamous cell carcinoma, you'd expect to see a basal cell. And they look a lot of the time like this. These ones get treated again with surgical excision, though they're usually small enough to do in the clinic. And these types of cancers rarely metastasize. Like, if it were to metastasize, that would be something that I would write up into a paper and submit to a journal, because that's extremely rare. If you're thinking that all these lesions kind of look the same, well, you're not alone. There's a lot of crossover between AKs or actinic keratoses, squamous cell, basal cell. Sometimes basal cell carcinomas can look just like this. You know, they have that rolled edges, kind of a pearly appearance around the outside, and there's something in the middle that kind of bleeds every once in a while that just won't get it to heal. They'll put a Band-Aid on it, and in a couple weeks it'll open up again and start bleeding when you touch it, and then may look and smell to a dermatologist or a doctor that it's basal cell. It might end up being a squamous cell carcinoma. So when we see something that we have a high enough level of suspicion, or generally if you make it into my office, it's coming off, we put it in the jar, send it to pathology, and they tell us what it is. And hopefully we've gotten it all at that time, but every once in a while we have to go back and re-resect to get negative margins. Now, the last skin cancer to talk about is the biggie. And this could be a doc talk, this could be a dermatology presentation, a grand rounds anywhere topic all on its own. Melanoma is sort of the kind of the dangerous one. I don't want you to think that the other types of skin cancer are to be taken lightly. They're cancers. But the melanoma is probably the most dangerous. It has the highest propensity to metastasize. And even if at initial presentation we find that it doesn't metastasize, it could show up 20 years down the road in some place completely remote from where it showed up at the beginning. This is a malignancy not so much of the thin layer, the epidermis, those types of skin cells. It's a malignancy of the melanocytes, or the pigment-containing cells that sit kind of between the epidermis and the dermis. The melanocytes are excellent cells. They multiply rapidly when exposed to sunlight. They help give you that nice tan, but that ultraviolet radiation does the same thing to the cells that make a melanoma as they do to the cells that make a squamous cell or a basal cell carcinoma. They'll cause DNA damage. That damage can accumulate and eventually lead to a dysfunctional cell that becomes a cancer. And so when we're seeing pigmented lesions, we diagnose melanomas with the ABCD criteria. And what those are asymmetry. So we're looking for the lesion to have some sort of asymmetry. We can have pigmented nevuses or moles all over your body, but if they're round, they're all the same color, been there forever, haven't changed, they're pretty easy to spot as benign. So that's the A. The B is the border. That's irregular borders. Again, something that's benign is usually smooth and round. This one is got real irregular borders all the way around it. C is for color, and color meaning it has different, it's like varied color within the lesion itself. It's a little bit dark over here, a little bit light in the middle, a little bit more dark on the other side. It's got a pretty wide variation of color, and that's something that would certainly send a red flag up to anybody who's looking at it. And D is diameter, so bigger lesions are more likely to be cancerous. And again, these metastasize all over the body. We'll try to excise these in the clinic with just a little bit of a margin to kind of essentially do an excisional biopsy. If it comes back as a melanoma, based on the pathologic characteristics of the lesion, whether it is very thick or deep or gets into the deeper layers of the skin, we might have to evaluate the lymph nodes and take wide margins around it. So even if we got negative margins on the initial excision or resection, if it's thick, we might have to get up to 2 centimeters outside of that to reduce the chance of recurrence in that area. So as you can imagine, if somebody presents with something that's 1 centimeter in diameter and it's deep, and you have to get 2 centimeters outside of that, it can quickly become quite a large area of skin that we have to resect for a relatively kind of small thing. So those are some of the things to be looking out for pigmented lesions. Again, the basal cells and squamous cells, they kind of look red, but the pigmented lesions are the ones that we've got to be a little bit careful with. And when we see pigmented lesions in the clinic, we're pretty liberal with the biopsies because things can change over time. There's a lot of variation between types of skin cancer and benign and malignant things, and the only way to know for sure, like I said, is to usually get it out or get a piece of it out and have it tested under the microscope. So hopefully that helps you identify some skin lesions with benign characteristics and some of the kind of characteristics that we look for and the things that we think about when we're looking for skin cancers. That is all that I got for you. Again, we went over the anatomy of the skin, basically the 2 layers, the epidermis and the little thicker dermis underneath where it's got all our good collagen and elastin. Talked about the skin and the sun and how those two kind of relate to each other and how the sun affects the skin and what types of effects it can have on both the skin cells inside and your skin kind of grossly as it can cause sunburns and the kind of classic signs of aging. And what to do to protect yourself. Basically, protect yourself from the sun, sunscreen, clothes. Be diligent about checking yourself for concerning lesions. Don't be bashful about coming in and showing the doctor if you're worried. Thank you.